One of the things that I saw in 2013 to 2016, when I was following practitioners of abortions in the South, was I was really shocked to come into a clinic and find that most of the people we were seeing were Black and brown. And I do think that the reason why we have, from the Hyde Amendment on, is people did not care that Black and brown women were losing access. And then the things that were successful, like cutting off that access, were spread to everyone. And it's too late to stop that tidal wave. But I would love for you to talk about bringing the experience of Black and brown women and all women of color into the conversation, and what you are doing in order to rectify that.
The work that I do, my work is centered in an academic space. I run a research center at Tufts University and School of Medicine, where I'm a full professor focusing on Black maternal health. And my research really looks at the intersection of race and gender and inequities, which are differences that's experienced by different people. Now, everything that my colleagues have said today is absolutely true and compounded for Black women. And so you're thinking about the conversation around Roe v. Wade, you're thinking about the Hyde Amendment, and you're thinking about how Black women historically and currently have been marginalized in the healthcare system. So I was smiling when Nisa said it was soul-sucking, because I'm going to start using that to think about the hospital system and just how dangerous it can be to access care as a Black or brown birthing person. But all of our work is community facing. So we have a community advisory board, a CAB, that holds us accountable, that partners with us on work. Right now, our big thing is getting doulas reimbursed as providers. So a doula is a trained birthing professional. And here in Massachusetts, through the recent Momnibus, anybody familiar with the Momnibus bill that was passed last August? I was at the State House 9 months pregnant, standing next to Governor Healy. It was amazing. And my staff was like, "You're going to go into labor." I said, "Well, everybody here is a midwife or an OBGYN, so it'll be fine." So that maternal health momnibus really paved the way for Massachusetts to continue to be a national leader in the maternal health space. Because a doula is a trained birthing professional that centers the pregnant person. We just started being able to get doulas reimbursed competitively, right? And the beauty of that is that doulas are now more likely to be able to make a living wage, so we can keep them in the workforce, increase and diversify our perinatal workforce, so we can try to close some of these gaps that we're talking about. And the impact we are having is tremendous, right? We're looking, how do we interrupt maternal outcomes for somebody that had an adverse pregnancy, and then we're looking at them, following them, they show up in the ED, they show up in observation. How do you really save that person's life in the inter-pregnancy period?